Hello and welcome to our ICU forum. Today is our first video about sepsis. In the beginning, I'm sorry for delaying posting this video. I had some technical issue about recording and uploading. This technical issue is my kids. So now, when we talk about sepsis, we need first to differentiate between what is sepsis and infection. Infection is local response to invasion of body organ to bacteria or virus, but sepsis, it represents mainly our body response to infection or other injuries, because not only bacteria or virus like COVID is the cause of sepsis. Maybe we have PERM can cause sepsis, some types of cancer can cause sepsis. So today we're focusing on infections, mainly bacterial infection. Maybe later on we'll talk about COVID specifically in one lecture. Me or one of my colleagues will talk about that. So mainly sites of infections that lead to sepsis. Number one is lung, pneumonia, different types of pneumonia, and then urinary tract infection. For hospitalized patient, mainly the patient with central lines and patient with catheter, and especially elderly patient suspected for sepsis. So when we suspect about sepsis, first we have symptoms for the patient. When we have hypothermia or hyperthermia, when we have tachycardia that deteriorates suddenly for the patient and there is no other causes. When we have hypotension, especially when systemic blood pressure go below 90, and when we have decreasing urine output below half milliliter per hour per kg. About the science and investigation, first of all, there's I think I have sent for you a PDF about that, how we manage. So when you admit the patient, you have to act quickly, because the problem with sepsis is time, mainly the time. The patient deteriorating in cascades. So our main issue to support the patient until we overcome this response. So number one, focus on giving antibiotic for the patient, but below do that, but not make you to delay giving antibiotic. Broad spectrum antibiotic is to take sample from 2 different sites for culture. Why? This will help us to manage with antibiotic later on, to escalate to increase antibiotic or decrease or to giving the specific antibiotic. Number 2, you have to search for the source for infection. Is it pneumonia? Is it urinary tract infection? Is it skin infection? So you have to search for the cause to try to treat it as soon as possible. What blood sample you have to taken from the patient? Of course, glucose is very important. UECs, LFTs. Okay. If you have cardiac problem, or suspect about cardiac problem, you have to take cardiac enzyme. But one of the most important recently that being so important in management of sepsis is lactate and procalcitonin. Why lactate? They found that lactate is related direct way to mortality rate in sepsis patient. The higher the lactate, the higher percentage of mortality. So number one, if you find the patient lactate level above 4 millimole, so it means that you have to interact so rapidly. Number 2, procalcitonin, it is correlate with the infection. We use it to follow up the infection, not to find. We need to know. So you will do series of procalcitonin. If it is decreasing, it means the infection level is decreasing. If it's still high or increasing, the source of infection is still there and the bacteria not controlled. So what we do with septic patient or sepsis? So we may have sepsis without septic shock. Okay. As all of us know, septic shock, it is type of sepsis of shock that can be affect the patient, that make him have vasodilatation, peripheral vasodilatation. So however, the patient is not hypovolemic, he has fluid, but because the tone of vessels is very low or very weak, it is like this pool of fluid or blood in periphery of the patient. So we have to manage this shock. Number one, we give fluid. Okay, what we give in first 3 hours, it is better to give crystalloids. Okay, Ringer or beta normal saline. Okay, and to avoid colloids like albumin or dextrose, we have to avoid this. We give 30 ml per kg in the first 3 hours. So we start when we have patient with hypovolemia, not hypovolemia. As we said, the patient is not hypovolemic mainly. The patient is have paralysis of vessels, as we said. So number one, we give fluid in case of hypotensive patient, 30 ml per kg in the first 3 hours. So we have to talk about two things that we have to do with this patient. Number one, antibiotic. We have to start with broad spectrum antibiotic. What is broad spectrum antibiotics? You can start with ceftriaxone plus azithromycin. This can cover a lot or many gram-positive and gram-negative bacteria. There is the list of broad spectrum that we can give. I will send later. And number two, in case of septic shock, we give fluid. This is very important. And of course, if the patient breathing is affected, like we have saturation is low, as we said before many times in our ICU, if you have been before work with us, ABC, okay? Airway, number one. B, the breathing, number two. Okay, and see, as we talk now about circulation, we have to support the patient with fluid, number one. If after 3 hours you have given the patient fluid and he's not responding, how we measure response? I think the time will not allow us to talk about that, but now there is many debate about the response. Some talk about urine output and some talk about CVB and say now it is not so accurate. And we have other ways using the ultrasound and echo to measure the response. But for now, let's say the blood pressure now is responding. Once if the patient is not responding to the fluid, number two, you have to go to vasopressor. What we have, number one, is no adrenaline. If no adrenaline is not working, we go to vasopressor. I think vasopressor not available in many ICUs, but this is the guidelines. So if patient is not responding to fluid and then no adrenaline, we can support with hydrocortisone, okay, 200 to 300 milligram per day. So this is for the septic shock, for the blood pressure. So as we said now, number one, you take samples for, even my kids, when they're sleeping, they're speaking. So now, number one, in managing patient for septic or sepsis, getting blood sample, okay, from two different sites. Of course, we put cannulas for this patient, two wide pores cannulas. If in septic shock, we start giving fluid, 30 ml crystalloids per kg in the first 3 hours, and we start with antibiotic. We not make the giving or taking sample delay us from giving broad spectrum antibiotic. Number three is supporting breathing. This is for the first say 6 hours of management of the patient. Then after 6 hours, you will repeat and measuring the lactate to see the response of the patient of perfusion. Why lactate? Let us summarize it. As I said, it is correlate with the morbidity or mortality of the patient. So it's good to measure the lactate levels to follow up your resuscitation for this patient. There's many ways we can talk about sepsis, but this is the most important. If you want to manage patient with sepsis problem, uh, number one, I repeat again, this is the first time, but I want you to make it like your name. You understand this and to act fast, because you can save patient if you act fast about that. Diagnose fast, okay? If you have a patient deteriorate very fast, okay? Is patient confused? He was okay, then he become confused, he become tachypnic, he blood pressure go down without reason, and then you go to managing, taking samples, our ordinary tests that we do for most of our ICU patients, but especially for this patient, lactate and buccal strain is very important. Number two, we give antibiotics, and we, as you said, we don't wait. If the blood sample would make a delay, we have to give antibiotics as much as we can, as fast as we can. Number three, if the patient has septic shock, we start with fluid, okay, and then by 30 ml per kg for the first 3 hours. If he is no responding, we go to catecholamines, especially we start with no adrenaline. If the patient is not responding to any fluid and no adrenaline, we go to vasopressor. If it's not available and the patient has no tachycardia, okay, and no tachyarrhythmia, we can give, if the no adrenaline is failed, we can give dopamine, okay, but also we can support with catecholamines, with corticosteroid, hydrocortisone 203 milligram on 2 doses or 3 doses per day for patient with septic shock. Maybe this information, I hope that help you. There are more details, but this is the most important points that we need to check. I send a checklist that you can use it. You can print it and start use it until you memorize the way to make it easy for you. Thank you, and for anyone have any question, please don't hesitate to send to me. This is Dr. Mustafa from Nakone Nursing Home ICU, and thank you.